Everybody, Luke Gordon here, and in this video we're going to talk about the 3 steps to lasting pain relief when it comes to neck pain and headaches. So this video we're going to cover a lot of things that I feel like are overlooked with a lot of physical therapy treatment, and so I just want to kind of share those with you to give you some better idea about how to get lasting pain relief once and for all for, again, neck pain and headaches. So the first step really with neck pain and headaches is that you really want to understand, like most things, you really want to understand the underlying root cause of what's causing your neck pain and headaches. So there's different things you need to look at when it comes to the neck. Big ones are like the suboccipital muscles up near the base of your skull, although there's also muscles along the sides of your neck and into your upper traps and things like that. I'm not going to go into too many details today, but there's a variety of causes of things like neck pain and headaches. So the muscles are one. You look at facet joints, so all the joints along the back of your neck, degenerative changes, things like that. So you really have to kind of dive into what are the structures involved. And again, the one I didn't mention was discs, any type of radiating pain. So you want to narrow down the structures involved, but also with the neck, you want to pay close attention to, well, one step kind of backwards or deeper is why are those structures irritated or inflamed or degenerated or things like that. So the neck has a very close relationship in terms of the muscles and location with your shoulder and your scapula, your shoulder blade. So there's those things to consider when you look at what's causing the neck pain. Of course, posture, sitting posture, using a computer, a laptop, tablet, things like that. All of those things really can be associated with the underlying cause of it. So again, don't stop at just knowing that it's these muscles here or these joints here or a disc over here or degenerative things here, but also know, well, what's causing those things and can you have a positive impact on those underlying causes, make some good changes there. So that's the first thing you want to do for lasting pain relief is really get down, really dive deep into what's really causing it before you start trying to treat it. Second thing then is when you're getting into treatment mode, especially my background of course is physical therapy, that's kind of my bias then, is that you really want to make sure if you're working with a physical therapist that they're doing a lot of work with their hands for you. So when the average person who comes into the clinic at Gordon PT, by the time they decide to come in for treatment of neck pain and headaches, usually it's been quite a while. At least 6 months is pretty typical, if not more like 2 to 3 years, 10 years, just because people put up with it for a long time. So by that time, the average person, just giving them stretches and exercises and helping them improve their posture isn't going to get them the results they want. It's not going to get them that much pain relief, and it usually isn't going to last. So again, if you're working with a therapist, make sure they're actually doing a lot of hands-on work with you. If you have muscles that are irritated, that they're doing the work for you, they're putting their hands on you, whether it's a deep tissue technique or a soft tissue technique or a myofascial technique, trigger point, strain, counter strain, whatever it is, they have to do the work for you in order to take down the inflammation, to get you to a certain level, to a certain baseline, where then you can maintain it. So that is my biggest soapbox with anything PT related. If you've heard my other videos, my other rants, is that people, the PTs, whoever you're working with, they've got to put their hands on you. They've got to get you that pain relief that you're looking for before trying to progress you on to stretches, strengthening exercises that are potentially painful. So that's a really big key for lasting pain relief. Make sure those therapists are putting their hands on you. Make sure they're the ones getting you reduced muscle tension, more improved mobility, joint mobility, and things like that. So after that, if you spent a good amount of time doing that, then you definitely want, this is the third thing, you definitely want to work on the stretches and improving your posture and improving your ergonomics. The way that I look at it with our clients is we use the 3 phases of healing, which I'll just show you the graphic for now. So phase 1 is the red phase here. That's where we're working on reducing pain and inflammation. So like I was just saying, a lot of work needs to be done in that red phase. I know on the sheet here it's just one of the 3. When you look at neck pain and headaches, if we were to change this diagram around, what you would want to see is that red phase would really expand. So you're spending a lot of time and effort in that red phase before you're trying to progress on to stretches and exercises, which would be phase 2 in the yellow phase. And phase 3, the green phase, where you're working on anything specifically, restoring specific activities and functions. So again, when it comes to neck pain and headaches, do you want to get to those phases? Absolutely. You just want to spend a lot of your time in phase 1 there, where the therapist is actually working on you. And then you want to get to the point where you're working on your posture, you're doing corrective exercises, you're working on changing your ergonomics and things like that. So those are the three things that I feel like if you really focus on when it comes to neck pain and headaches, if you really keep those three in mind, you'll have a really good shot at lasting pain relief and feeling good. So hopefully that helps you just kind of understand things and put things into perspective when you're going through treatment. Keep in mind too that not all physical therapists treat the same, so it's never a bad idea to get a second opinion, even if you've gone through it with someone and didn't get the results you're looking for. So I hope that helps you out. Please leave any questions or comments below. Thanks for watching.